I definitely feel it's given me a sound understanding of the role of a clinical pharmacist within primary care.
GP is very much patient focused, and I feel like this helped me develop my communication skills because each individual patient was different, so I needed to tailor my communication skills exactly to them.
What I've been doing as a GP trainee at pre-reg is been doing a lot of processing patients' discharges and clinic letters, communicating with patients, dealing with their queries.
In addition to this, it's given me the opportunity to work alongside a variety of different healthcare professionals.
I also feel it helped me develop my clinical skills because I was completing medicines reconciliation when a patient had been discharged from hospital and making sure that all their medicines lined up and it was all safe as well.
Reviewing all the patient's medications, checking that their monitoring is up to date, discussing with the patients any adherence issues or any medication queries.
I've been able to undertake a very interesting and exciting clinical project.
So it's been really, really useful to be able to work in both because I can fully understand the process and also explain that to patients as well as the two teams that I'm working with.
When I was looking at TTAs for a patient to go home, I understood the timeliness of when things would need to be reviewed and whether that was actually achievable in GP practice.
Working within general practice allowed me to develop a deep understanding of the issues that patients face when they're discharged from hospital. So when I was working in hospital, I was mindful of this and I could take the appropriate steps to ensure a smoother transition for patients from hospital into primary care.
Getting used to System 1, which is the system in the GP practice, and just becoming very, very capable of working on that.
I think I found doing my own clinics the most useful. This was really good because I could speak to patients one-on-one. There was a practice nurse who was supervising me and I could always get in contact with my tutor. But it was really good for having a bit of autonomy.
Undertaking a clinical project, and the results of my project I then presented to the GP partners and nurses, and it was a fantastic opportunity for me to give something back to the practice, and it also highlighted the importance of pharmacy presence within general practice and the impact that we can have.
Talking to the GPs and nurses and the other pharmacists, because they are just a bank of information. All of them have so much knowledge and they've been working for so long, they all know so much, and obviously you as a new trainee doesn't know as much as you probably could do, and it's always useful to just sit with them, watch what they do, how they work, and listen on their conversations and try and pick up and absorb as much information from all of them as possible.